Welcome to CEBSAR TALK. I am Evans Apia Kisi, the host of CEBSAR TALK. CEBSAR is Center for Better Society Advocacy and Research Africa. Cebsarafrica is a non-profit organization that believes in a better society for all. We in Cebsarafrica believe that a better society begins with you and I. Hashtag, a better society begins with me. For more information, please log on to www.cebsarafrica.org. Please don't forget to follow us on the various social media platforms: YouTube, CEBSAR TALK, Facebook at CEBSAR Africa, Instagram, CEBSAR Africa, Twitter at CEBSAR Africa. Like always, today we bring you another interesting discussion on our series of interrogating the manifestos. And today we focus on health. Political election manifestos are public declarations of policies and aims of political parties wanting to rule a nation. Given that the manifesto is a social contract that plays a key role in modern democracy and development, we put available manifestos in their place going into election 2020 of Ghana. It is important to note that the discussion is not to pitch one manifesto against the other in terms of superiority, but to look at how the promises address the desired level of development we require as a society. By so doing, we are able to highlight the gaps in these manifestos for a better society. And in this episode of CEBSAR Talk, we focus on the health sector. To help us deal with this important issue are Dr. Nasignibe Kunibe, is a lecturer and a researcher at Simon Jindong University of Business and Integrated Development Studies, Ghana. He holds PhD in Public Health from Heidelberg University, Germany. He also holds MPhil in Economics from the University of Cape Coast, Ghana, and a BA in Economics from the University of Cape Coast, Ghana. His research focuses in health economics. We are so grateful to have you on CEBSAR Talk, Dr. Kunibe. Welcome to CEBSAR Talk.
Thank you.
Thank you. And our next guest is Mr. Michael Edu Jemfi. He's also a lecturer and researcher at the University of Health and Allied Health Sciences, in Ghana. He's a former principal medical laboratory scientist from the Kwame Nkrumah University of Science and Technology Hospital and Komfo Anokye Teaching Hospital in Kumasi, Ghana. He's a doctoral researcher at Charité Universitäts Medicine in Berlin, Germany. He holds MPhil in Human Anatomy and Cell Biology at the Kwame Nkrumah University of Science and Technology, Ghana. And he also holds BSc in Medical Laboratory from the same university. His research focus is in nephrology and immunology. It's a pleasure to host you on CEBSAR Talk. Welcome to CEBSAR Talk, Mr. Jemfi.
Yeah, thank you very much for the opportunity. I'm grateful.
Thank you very much. And our last guest, who is obviously not new to CEBSAR Talk, is Dr. Ishmael Rekun. He's Health and Social Policy Analyst. He's currently a policy analyst for the Ministry of Energy and Resources, Regina, Canada. He holds PhD in Public Policy from the Johnson Shoyama Graduate School of Public Policy, USASK in Canada. He holds MA in Political Science in Public Administration from the Brock University, Ontario, Canada. And he holds BA in Political Science from the University of Ghana, Legon. His expertise lies in health and social policy, mineral land policy, and elections. It's always a pleasure to host you. Welcome once again to CEBSAR TALK, Dr. Rekun.
Evans, thank you for having me. I'm pleased to be here.
Great. And let me say welcome again to our panelists here and to our fellow Cebsarians. We're grateful to you and happy that you follow us today as well. Please don't forget to like, comment, and share our videos. So we'll begin right away. And it's important that I also mention to our viewers that our panelists here, what we are going to do, let me start it this way. What we are going to do today, like we did last week, is to look at 3 available manifestos, one from the ruling New Patriotic Party, the other from the largest opposition party, the National Democratic Council, the NDC, and then another manifesto from an independent candidate, Mr. Marek Kofi Ghani. It's important that our viewers note that our panelists do not represent or speak for these political parties. It's an intellectual discussion that we are having on how to interrogate these manifestos in order to help move Ghana forward. And so, like I said, Michael Edujemfi will focus on the MPP manifesto, Dr. Kunibe will focus on the independent candidates manifesto, and then Dr. Rekun will focus on the NDC manifesto. But of course, you would have the opportunity to comment on any other manifesto that you wish to do so. So like we did last week, I think I will do it this way because the independent candidates manifesto was the one launched first, as far back as last year. We will begin with that. And so I'll begin with you, Dr. Kunibe, then later I come to Edujemfi for the MPP manifesto, and then Dr. Rekun will then look at the NDC manifesto. So in this very first round, what we look at basically is the structure and relevance. So I'll start with you, Dr. Kunibe. If you look at Marek's manifesto, can you give us a summary of the structuring of the manifesto? You know, which levels or areas of health do you feel that the manifesto touched or failed to touch? Thank you.
Thank you, Evans. I think the independent candidate, without institutional structures, has done, in my opinion, quite well in the way he structured the manifesto. He's tried to capture all the relevant issues that will inform health policy. He's tried to capture issues on access, issues on human resources for health, health efficiency, and infrastructure. What I haven't seen, and this is not to pitch anything against him or his team, but what I have not seen prominent and will want to see in many other manifestos is that we have a huge environmental health problem in Ghana. And for me, I think this is something that we must address as a nation, because most of our infectious diseases, especially malaria, comes from this angle, that you have the environment so filthy, mosquitoes are all over. I did not see this. He did not also make very clear what his policy is on maternal and child health, even though there are general issues on health. Because this is also one key area that the WHO wants to see handled well. And for most countries, especially in low and middle income countries, we still have a lot to do when it comes to reducing maternal and child mortality. So I haven't seen that very, very well represented. I have not also seen in the manifesto prominently featured issues on infectious diseases. Maybe before he launched his manifesto, he probably launched his manifesto before the issue of COVID-19. But you would agree that it's awakening to many nations that even though this is not something that occurs frequently, we should learn to deal with issues like that. And I have not also seen the aspect of responsiveness. This is a key if you like, theme when it comes to achieving universal health coverage. And for this particular one, if you allow me, it's just not his manifesto. I have looked at the MPP's manifesto, I've looked at the NDC's manifesto. They do not seem to talk about how responsive the health system should be to patients' needs and desires. And we still have the situation where, you know, the nurse or the doctor or whoever that is at the facility determines the fate of the patient. And in many cases, you have cases of neglect that end in very bad scenarios. And it's unfortunate that these manifestos still think that we should not give prominence to how the system should respond to the needs of patients. But otherwise, on the whole, I think that the issues that he has raised are relevant to ensuring that as a country we improve the health of our population.
All right, thank you very much, Dr. Kunibe. I'll definitely come back to you to look at relevance and also maybe ask you some follow-up questions. But you clearly state that the independent candidates manifesto was well structured, except that he failed to mention a few things such as maternal and child care, environmental health problems, and also infectious diseases that you rightly said probably they launched it before the COVID-19 outbreak, and also issues of responsiveness. So I come to you, Edu Jemfi, similar question as well. I mean, when you look at the MPP's manifesto, what do you think about the structuring of the manifesto, and what level or areas of health does it touch, or in your opinion failed to touch? You could also say something about what the submission that Dr. Kunibe has already given us with regards to what the independent candidates manifesto failed to touch. You may do so as well. Thank you.
Okay, thank you very much once again for the opportunity. I think that the MPP's manifesto presented itself in much more of like a progress report, and they had to do so because this is a government in power, and so they had to account for their stewardship, and they have to also give what the way forward for what they're about, what they seek to do. And so largely the MPP's manifesto, as captured in about 5 parts, seeks to look at the general overlook of Ghana, i.e. the challenges that we have faced in terms of health and how they intend to resolve it. And generally, this is something that I would want to put across first. The structure of the MPP's manifesto is something that I believe certain governments should be able to emulate. Why? Because you are in government, and you are supposed to account for your stewardship, even though there are meetings which goes on. For anybody who doesn't know Ghana and would want to pick just your manifesto to look at how you have performed, your manifesto should be able to give that picture. And the MPP manifesto is able to give us that picture. So I say that I like the way they have structured their manifesto. The preface for me is very much, on point. It demonstrates what they seek to do and the challenges that they came to meet. Largely, the MPP manifesto, in terms of health, captured a whole lot of things. I mean, it seeks to capture issues on access to healthcare, and of course, because the government in power, they look at the investor health coverage issue. So they look at access to healthcare, they look at services, they look at human resource development and its recruitment, they look at health financing, they look at health infrastructure, and also look at the management of infectious diseases, i.e. the COVID-19. They also attempt to also look at it. Of course, with regards to what my fellow panelists said on environment and sanitation, the MPP manifesto also looks at that area. My shortfall would be that I'm sure we'll come back in detail to that aspect, but my shortfall would be that in terms of the services, their focus was much more on emergency services. What they have done with the ambulance service, what they have done with the drone delivery and what have you. But apart from emergency services, there are other service areas which needed care, like Dr. Nasimbe just put it. There are issues of secondary healthcare, there are issues of tertiary healthcare, which you ought to look at. There are issues of maternal health, which one would want to look at it. But I would say that I also did a bit of research, and you realize that some of these issues are all captured in what is referred to as the National Health Policy, which has been drafted or which has been reviewed by the Ministry of Health. So some of them are also well laid out in the National Health Policy, and they did not find mention in the NPP's manifesto. So by and large, I think that the NPP's manifesto really captures a whole lot of areas in health for now. And if we are to go by that, I think that it is a good one. I'm sure with time we'll come to the specifics and we can speak to specific issues on the manifesto. Thank you.
Thank you very much, Mr. Jemfi. So that was a very good one there. You say that the MPP manifesto, which was also said last week on the show, it's more of a progress report, which is required as a government in power. So it's more of an account for their stewardship. And it looks good for you. The structure is good, except the shortfall on secondary healthcare and tertiary healthcare. Maybe just for our viewers, and when you say a falls short, I mean, like Dr. Kunibe mentioned some of the shortfalls of the independent candidates manifesto. He was a bit specific, talking about maternal and child care and environmental health problem. When you say the MPP's manifesto falls short of secondary and tertiary healthcare, what exactly do you mean?
Okay, thank you very much. I think that health services generally is divided into three. The primary healthcare, which you basically look at services which will not necessarily require a doctor to handle, like handling of malaria, simple infections, and what have you. And the secondary healthcare, which basically is seated with the district hospitals, and those who go into the management of diseases like hypertension and what have you. Then the tertiary healthcare will go into the much more diseases with complications. And for instance, neurological services like transplant and kidney transplant, my area. So of course I have to mention that those areas and those areas were not well captured in that. So that is what I mean by tertiary and secondary healthcare.
Thank you very much. So Dr. Reku, what do you also have to say to the NDC's manifesto in terms of the structuring, what policies they failed to enumerate or touch on as far as our health system is concerned?
All right. Well, Evans, thank you so much for the opportunity. And also, thanks to my co-panelists for laying the framework, for us in this discussion. Yeah, so when we talk about the NDC manifesto, I'll say that, the goal of this manifesto is to ensure or achieve a universal health coverage. And for that matter, they titled their manifesto, especially in the area of healthcare, the theme is health for all. Okay, so that is an interesting objective they've set. And when you look at the manifesto, it's very comprehensive. I think it has the broadest in scope, so far as all the two manifestos we're talking about are concerned. It has a broader scope than all of them. It talks about, health infrastructure. So you're looking at expanding infrastructure facilities in the area of healthcare. They target all the levels of healthcare from primary, secondary to tertiary. So they intend expanding infrastructure across board. It's also talking about health financing, particularly the National Health Insurance Scheme. Trying to ensure that, there is sustainable funding for the National Health Insurance Scheme. So that's a good one. When you look at it also, there are some key ones actually I saw in the manifesto, and I love it. For instance, maternal care, Doc talked about the independent candidates, not, focusing on maternal care. I see NDC actually, giving a lot of attention to maternal care in their manifesto. They intend reducing maternal care by even 50%. Okay, so they also introducing some antenatal incentives, as well as what's it called, free maternal care of about additional 4-month maternity leave. Okay, maternity leave for Ghanaians, women, and then also 1 week for men, paternity leave. So it's a great one. I also see rural healthcare. Trying to build cheap compounds, okay, and also providing, some, they call this emergency ships. They call them Unradoreba. I think they may have started that, during their previous term, but they intend to make sure that, healthcare become accessible to people at the grassroots. Another one that I saw, which is interesting, is long-term care. Usually we don't really focus on long-term care, like the aged, the elderly people in our society. I see NDC also trying to focus a lot of attention in the area of long-term care. For instance, let me give you an example. They want to establish, park, that will take care of, maternal people of older age, and so that they can go there and relax. They're also looking to establish something like co-payment arrangement that will help, older people to be able to afford their medications. Okay, so this is a good thing. One criticism, and a number of them that I will give to this manifesto is that a lot of the issues they intend to address are operational in nature. Rather than strategic. We are looking at a manifesto, and the manifesto is a strategic document to achieve, an objective, of the government. I was expecting them to pay attention to just the strategic ones, rather than the operational stuff like providing anti-snake serum, introduce antenatal incentive, provide free sanitary pads for girls. These to me are not really major issues for a manifesto. We also see some kind of arrangement. Some of the organizations are poor. We talk about healthcare infrastructure, and by the time you realize, some of the items under the healthcare infrastructure team are not actually related to infrastructure, okay? And you see a lot of repetition of the policies they intend to, to pursue in various areas of the manifesto, which make it kind of not interesting. Okay, but one thing I'm going to talk about is the fact that once this is a strategic document, I was expecting that they will lay a framework, like build a problem statement, okay, so that we can actually relate their recommendation or their promises to the problem, at stake. Without doing much of the problem explanations and the statement for us to understand, it's very difficult to even establish whether what they are proposing are relevant or not. Okay, especially for the ordinary Ghanaian that might not do the research, okay, but really want to find out that, this is a government that is up to the objective or the goal that we all want to see in the country. I was expecting that they will lay a strong problem statement before making the recommendation or the promises they are putting across. So these are a few things that I can talk about with respect to the structure of the manifesto.
Thank you very much, Dr. Rekun. I think you already kickstarted my next question to all of you in terms of relevance, whether these promises that you have touched on, whether indeed they answer the pressing health problems in the Ghanaian system or not. But just to give a summary of what you said, so you also see that in terms of structure, the NDC's manifesto is very comprehensive. It touches on a lot of healthcare levels, I guess from what Edujemfi already talked about in terms of primary, secondary, and tertiary healthcare. There's maternal care, you match the rural healthcare, and then the long-term care for the aged. But what you feel that it failed to look at is more strategic than operational. And then also the fact that they should have at least begun with a problem statement in order to be able to tell us that this is how they intend to solve it. Thank you very much. So I come to you, Dr. Kunibe, and let's come to this question on relevance. So Yes, we've seen the structure of the independent candidates manifesto. It looks good, as you said, but there are a few things missing. But let's look at the promises. I mean, the individual promises, if you could touch on any of them. Do you feel that they indeed, address the pressing health problems we have in our society? Thank you.
Yes, thank you. One key thing they talked about, which I feel that as a nation, we must handle and find a way of handling it head on, is the human resources for health. I mean, he talked about equitable distribution of health personnel, especially doctors, to all locations of the country. I think this has been a policy objective for many governments, except that I don't see that they have succeeded, partly because of the fewer number of doctors that we continue to train. And I honestly don't understand why we want to continue down that lane. And then coupled with the fact that as a nation, we do not have equal social infrastructure, we do not have equal economic infrastructure. And so if you are talking about a medical doctor who has a family and who desires the best for his or her family, this person is not likely to accept postings to a deprived area when the incentives are only financial, because this person is going to have kids who will go to school and will want the child definitely to be exposed to the best educational opportunities. So in the present context that we still have, excuse me, we still have a lot of disparities. I see that this is a very important objective, but still very going to be difficult to achieve unless we move towards creating equal opportunities beyond the health sector across all locations in the country. He also talked about improving efficiency, which entails taking audit of the health infrastructure, what is there, and then trying to see whether we are making the best out of it. I think this is also very relevant because personally, I am not convinced that as a nation, we are being very efficient with our health resources, human infrastructure, and again, except that I did not see how, when you come to the specifics, he will be able to implement this. But I think that if we are able to improve the efficiency of our health system, like he captured in his manifesto, and I believe one of the aims of these discussions is just not that once party A or B or candidate A or B wins, then stick to, these are national issues. I really would want to see that whoever that comes to power should find some interesting things in the others' manifestos to handle. Another very interesting thing, which I find relevant, is the issue of claim payment when it comes to the national health insurance. I have always said, and this is my personal view, that our revenue portfolio for the NHIS is more than enough. If you look at the way we have structured it, that authority should not, at any point in time, say that they do not have enough money. But we have not committed ourselves as a nation, one, to releasing the money in good time from the consolidated fund to the authority, and secondly, we have not committed ourselves to paying claims on time. And this is a disincentive, not just to the providers, but also to the consumers. Because if I go to a facility and all that happens is that I have drugs prescribed for me and I'm supposed to go and buy when I'm a card bearer. you know, next time I really will think twice before I choose to enroll on the insurance scheme. And why do the facilities do so? They do so because they put in claims. It takes months, sometimes years, and they don't have the claims paid. And definitely there's no way that they're going to be able to operate. So if this is one of his priorities as an independent candidate, I think that is relevant in moving forward our financial access to health. So that it should not be that in the current situation you have many people enrolled, we say up to 40%. But if you ask me, more than half of this 40% are still financially struggling. They do not have financial access to health because in the end they still have to pay so much to buy medicines. In addition to the fact that they have to transport themselves when there is a need. And these are people who do not already have means of transport on their own, you know, living very far away from hospitals. And also because the primary facilities are not delivering because of this lack of claim payment. Many people end up reporting to the facilities very late, and then they are referred to higher level facilities, and the cost becomes unbearable. So there are a lot of things he has talked about in the manifesto, but I find these three things key in his manifesto, because if we are able to address the issue of human resource, if we are able to address the issue of efficiency, and then the issue of financial access, I think that when we build hospitals or clinics, we will get value for money. But if we don't address these issues, even if we have a lot of infrastructure dotted around, I mean, it's still not going to change the situation a lot. So these are the relevant issues that I find in his manifesto.
All right, thank you very much, Dr. Kunibe. When we come to the second round, perhaps there will look more into content analysis, whether these issues that you talk about are something that could be achieved and something that is, you know, indeed able to impact on our health system positively. But maybe just a quick one about the National Health Insurance Scheme that you mentioned. You said that we do have enough revenue portfolio as far as our national health system is concerned. And so what is the current problem with it? Because you talked about the fact that about 40%, which actually is also in doubt, you know, rolled on to the National Health Insurance Scheme, but yet they still have to pay more when they go to the hospitals. I mean, how is this possible?
Yeah, I mean, I think, as I mentioned, the problem I see is the flow of the revenue from the consolidated fund to the National Health Authority. You know, by law, the revenues are first supposed to be lodged in the consolidated fund. And the Minister of Finance is now supposed to release this to the authority, I think within some specified amount of time. But it is usually the case that these monies are not released on time. And of course, you have the head of the authority appointed by government. So this person is definitely not going to antagonize the government unless you do not want your job, you know. So I think this is where the complication is. Yeah.
All right, thank you very much, Dr. Kunibe. So in terms of relevance, he touches on the fact that the idea to, you know, expand our human resources and also expand infrastructure to aid efficiency and to improve the financial flow into the health sector is something which is very key in the independent candidates manifesto. So I come to you, Mr. Jemfi. Same question also. What do you find in the MPP's manifesto that you think is you know, these promises indeed answers the pressing health problems that we have in our system? Thank you.
Okay, thank you very much once again. I think that the goal of healthcare now all over the world is to achieve universal health coverage. And so the MPP manifesto attempts to look at that. And the MPP manifesto, like I said, gives a report of what they have done, even in 2000 to 2008 when they were in office, and from 2016 to now as they are in office and what they put in place. So, like my colleague talked about, the main challenge to achieving investor health coverage is access. Access, i.e. by lack of finances, access by lack of infrastructure, and access by inefficient service. And maybe you may add the inadequate human resource capacity in the various hospitals or in the various health facilities. So the MPP manifesto attempts to give an account of, in terms of access by way of finance, what they have done. What they have done, according to their manifesto, is that they introduced the National Health Insurance Policy, which is one which is cleared, and everybody knows that it is one which is cleared a whole lot of the access issues in terms of finance. And even in that policy, they make it, they make it free for the elderly, they make it free for children not to pay premiums. So in terms of finance, they try to work on that. And again, like Dr. Nasimbe just put it, the main challenge of our healthcare in terms of access and in terms of access, financial access, has to do with the overburdening of the National Health Insurance Authority and its finances. NPP manifesto captures that when they came into power, they realized that there was much more of a deficit in terms of the payments of service that health facilities have delivered by the NHI. And they have cleared over 10 billion of them. And now they are current with the payment, such that they have paid all the arrears and they only owe 3 months, which is said to be normal in terms of the payment structure. So in terms of financial access, the NPP speaks to that. And for me, it serves all our interest. Again, in terms of access, in terms of infrastructure, they look at what they came to meet in terms of the fiscal infrastructure and what they have done. They say that they began with, they began 624 projects, and about 80 to 90% of them have been completed. The projects which they came to meet, they are working on, and they've completed a whole number of them, and they are working on some of them. So in terms of infrastructure, in their 2020 manifesto, by the promises that they have made in the 2020 manifesto, they also say that they will build more of the facilities, of the health facilities. Again, the second issue has to do with services. This is why, again, I say that the NPP manifesto has largely dealt with emergency services. Like Dr. Rekon spoke to the maternal health care, I have not cited anywhere in the manifesto where they speak to specific policy issues on maternal health care. Maybe, like I said, one would have to refer to the National Health Policy to see the main strategy, the NPP's strategy on maternal health care. But in the manifesto, you will not see. But largely, in terms of emergency, in terms of infectious disease, they speak to it, and they seek to also build infectious disease centers. In terms of the services, i.e. the tertiary services, Dr. Rekun made mention of that, like building, caring for the aged. This is one of the key points of the NPP's manifesto, where they seek to look at promotion, health promotion, and health prevention. And they also even look at palliative care and geriatric care. These are things which are not well known in Ghanaian settings. And they seek to, they cite that they've constructed a rehabilitation centers in Jodowa, I think in Legon and in Tema. I feel that if this is the case, then it should be scaled up the whole of Ghana so that some of these centers should be readily available. So I think that the NPP manifesto largely is much relevant, except that in terms of the services, it does not really speak to the specific policy issues on services and what they intend to do. In terms of human resource development, they say that they came to meet the backlog of health professionals who are at home, and majority of them have been recruited, and they provide the statistics. That is also a good thing. But what we need to speak to, maybe we'll come to what we need to speak to, is about a fair distribution of the health professionals. I have had the opportunity of surveying some of the rural communities and the kind of health service they are exposed to. Honestly, it is something the country must really look at it. And Dr. Nasimi made mention of that. We have to look at providing specific incentives to our healthcare providers who work in the villages. It is something that the nation must really look at it, because you go to a whole district and you don't have a pharmacist. You go to a whole district, and in the whole district you don't have a radiographer. So you ask yourself, if somebody has a fracture of the knee or a fracture of the leg, how will the person have access to medical imaging or x-rays? These are things which are happening in our villages, and this is something that we must, all of us, must address. So in terms of the distribution, you go to the tertiary hospitals and you have a whole number of doctors and a whole number of health staff, sorry to say, crowded there. So we have to look at the fair distribution of some of the, and sometimes we would also have to agree with the health professionals, because like Dr. Nasimi just put it, everybody would want to develop. So it is difficult to go to the village.
Yes, Michael, there is Dr. Kunibe.
Kunibe, yeah, Dr. Kunibe, yeah. Sorry. So we just have to, this is something that we just have to, all of us have to look at it carefully. But generally, by and large, the NPP manifesto, in terms of its relevance, yes, they are relevant, digitization, recruitment, the ambulance service which they brought, also capturing emergency services, the establishment of the wellness centers, in terms of mental health, they say they've passed the legislative instrument for mental health, they implemented a national emergency, and for the drone service, which we may speak to some other time, and a whole lot of things. So generally, by and large, the NPP manifesto captures a lot of things. And finally, before I leave this on this, Dr. Rakon made mention of creation of citing of centers, i.e. caring for complicated diseases or non-communicable diseases, as we put it. The NPP says that they have absorbed breast cancer screening, and that now breast cancer screening is free, and the drug, which was so expensive, is also free. This is what they put in the manifesto. We are not in Ghana to assess it for ourselves, but I believe it is so. If it is so, this is good. But I say that it is not just about breast cancer, which is prevalent in Ghana in terms of non-communicable diseases. Men also suffer from prostate cancer. These are things which we must all look at. Sickle cell is also there. Diabetes, hypertension still remain with us. There should be specific policies on some of these things. So generally, this is my view on the NPP manifesto and its relevance.
Thank you. Thank you very much, Mr. Jemfi. So pretty much similar points as alluded by Dr. Kunibe, particularly with the issue of distribution of resources and also the infrastructure. I think this is something that both the MPP manifesto and the independent candidates manifesto fails to, address. And it's something that we would have to look at very well as a country. But by and large, the MPP manifesto, as said by Mr. Jemfi, also looks very promising and relevant in addressing the healthcare problems that we have, because it addresses issues such as access, and also it addresses infrastructure, but also it lacks a bit with the services, as he said. Thank you very much. So I come to you, Dr. Rekun. What do you also say to the NDC's manifesto? Do you think that the promises in them indeed addresses the pressing problems in our healthcare system or not?
Well, Evans, yeah, I think so. I think NDC's manifesto has a lot of potential in trying to address the healthcare issues we face as a country. We have a lot of people or students who have completed medical schools or nursing training colleges, and they are not able to get, they are not being posted. Okay, and this has been an issue. Of course, as Mr. Jemfi talked about, the MPP has made some progress in recruiting some of these people, but still there are others who have still not been able to secure places of work. And we have been seeing that this once a while, where some of these nurses have been going on demonstration. Sometimes they even go to the Ministry of Health trying to, put across their issues. So I think that, I mean, NDC trying to employ the backlog that we have, I mean, in the health sector is a great thing. And I think that it's one of the things that we need as a country. Then we talk about health infrastructure. I mean, it's trying to build some, I mean, just a regional, I mean, hospital in all the 6 new regions. I mean, which I think MPP has similar promise also. I think that this is something that is timely because we have now created, I mean, 6 more regions. So getting them these infrastructures is something that's a good thing for us to acknowledge. And another thing that I want to bring across, and I think it is one of the unique promise of the NDC, is that they want to provide free primary health care. Okay, free primary health care. I mean, I don't think any of the other, I mean, manifestos have something like this. But I see this as very critical. You know, as a country, I mean, and as a country that is seeking to achieve universal health coverage, we need to ensure that, I mean, people are able to access basic health care, I mean, services. Okay, like in primary health care, Jenfi talked about, like malaria, you know, like simple diseases and sanitation and those, I mean, medication. You know, these are basic services that we expect each and every one in Ghana to have access to. And the National Health Insurance Scheme has been able to give some exemptions, but there are problems, you know, that has not been able to help engage or enroll some of these people in the local communities that are poor, and because of that, they have not been able to access healthcare. So making primary healthcare free means that each and every one will be able to afford or be able to have these basic services in our communities. I think this is something that is timely. I mean, we have aspired for this goal since the 1970s. We have not been able to achieve, I mean, a comprehensive primary healthcare service. I think that NDC, if it's able to implement this, okay, it's going to help a lot in Ghana. Then another issue is about the National Health Insurance Scheme, or especially the levy. You know, Mr. Doc Nasigbe talked about this. I mean, the National Health Insurance Scheme has been very good, I mean, for the country, especially the fact that we moved from cash and carry to National Health Insurance Scheme has been very good. But I think that, I mean, the Health Insurance Authority has not been able to have access to all the funding they need. Okay, and because government has been diverting this funding for other projects, they have not been able to do that. You know, I did some research in 2014 about, and I think that was the complaint I got from most of the workers in the National Health Insurance Authority that I interviewed, saying that they don't even get the money, because I was thinking that the money was going into a separate account, but it is not the case. It goes into the consolidated fund, which the government can use it for any purpose. And for the fact that we have been hearing that they have not been paid, sometimes even for 12 months, sometimes, I mean, NPP said they have been able to reduce the arrears to about 3 months. But still, we still have some backlog of arrears that we need to. Without a strong financial base for the National Health Insurance Scheme, it cannot be very effective. And that's why, even though we have the National Health Insurance Scheme, we still have a lot of people still doing cash and carry. Okay, out-of-pocket payment, according to research, is about 40%. And National Health Insurance Scheme access is less than 40%, okay, or about that amount. So, I mean, making sure that we secure the funding for the National Health Insurance Scheme, which NDC wants to do, okay, so that they don't divert the money into other purposes, but they want to make sure that it is specifically geared towards the National Health Insurance Scheme. I think that this is a laudable idea, and we should encourage that. And also, we talk about, I mean, importation of, I mean, talk about COVID-19. So they have agenda for COVID-19. That is relevant because it doesn't appear that the COVID-19 thing is going away anytime soon. So we need some kind of strategy that will help us to cope with it. Okay, but it shouldn't be only that. We should look at infectious disease in general so that, I mean, we can address them in a more meaningful way. It's also talk about integration of traditional medicine and local production of, I mean, medicine and other. I think that this is a good thing. Okay, we have been talking about integration. We have not been able to effectively integrate traditional medicine into the healthcare, the normal healthcare system. And I think that, I mean, having a strategy by which, I mean, some kind of tax incentive will be given to people who engage in local production of medicine, and to incentivize people to engage in traditional medicine is a great thing, and it will help us to reduce the cost of medication in the country. Of course, there are some areas that I think are not really interesting, and I mentioned some of them already. By, like, for instance, providing, declare, renal or kidney failure a national emergency. So what? If you declare it as a national emergency, what happens? Okay, this is irrelevant. We don't need that. And reward healthcare workers that accept posting to rural communities with work abroad. Okay, 5-year work abroad. What does it mean? We want to retain the healthcare workers in the rural communities. We don't want to make them transiting from the rural areas into working abroad, then another batch come into rural areas and work abroad. We want to retain them. We have to introduce incentive or some kind of arrangement that is going to keep them in the rural communities and for them to enjoy better life, just like any other people working in the urban areas. I think that if we do that, and they have similar thing for exchange program for health workers. These to me are not relevant. We need to retain our healthcare workers in our communities so that they can provide the needed service that we need in our community. So, even these are some of the things I think are not really relevant to us, and the other ones are things I think are going to be helpful to our country if they are implemented by the NDC. So that's if they win government and then implement them. That will help Ghana a lot, but some are not interested.
Thank you very much, Dr. Rekun. So he touches on the fact that the promise of the free primary health care and also I would say the improvement in the National Health Insurance Scheme financing, these are very relevant promises, but also the lack of incentives, perhaps it's something that probably might defeat these promises, making it irrelevant. But just to follow up quickly about this primary health care, what do you say to others who say that this introduction of the primary health care, then what makes of the National Health Insurance Scheme and also the IGF that is generated by these hospitals? Because as it has already been stated here, I think the National Health Insurance Scheme caters more for these primary health care, right? And so what happens to these hospitals, even though we know payment is sometimes not regular, but at least they're able to generate something through the National Health Insurance Scheme. So what becomes of them if primary health care indeed is realized?
Yeah, Evans, I think, this question we could have dealt with that under the feasibility, but I will highlight some of the things about the National Health Insurance Scheme. The National Health Insurance Scheme has a great policy provision, but one of the key challenges of the National Health Insurance Scheme is the ability to provide services of free enrollment to people who are supposed to be exempt under the National Health Insurance Scheme. And that's why we have a bulk of the people that actually need the primary healthcare services. Okay, so we talk about indigent, okay, the poor, okay, we talk about children and that. Without data, it is always difficult to implement some of these means-tested policies, okay? I call them means-tested policies because they are not universal. It's only segment of the people, okay, that qualify for them. You need to qualify. So in Ghana, how are you able to determine that this person is poor or not? So that they can have free enrollment to the National Health Insurance Scheme. Okay, so by the fact that we are not able to determine that, this person is poor, it's always impossible and challenging for the healthcare staff and the National Health Insurance Scheme staff to be able to exempt certain people. Until we are able to identify, systematic arrangement to identify people who meet certain exemptions, it's always going to be very difficult. So we'll have the National Health Insurance saying that it's free enrollment for children, free enrollment for the poor, but it will never be implemented. We had similar arrangement for the cash and carry. It didn't work. So by the time we realized all healthcare facilities were charging for those who are supposed to be exempt for the cash and carry. And so the same thing is happening. It has transitioned to the National Health Insurance Scheme because we don't have a systematic arrangement to actually determine who is poor. It's getting problematic. And for that matter, access to the National Health Insurance, like I told you, is even below 40%. and cash and carry is still going on at the rate of about 40%, you know. So you will see that even though we have national health insurance scheme, and according to the policy, if it is implemented successfully, we should be able to have a lot of people having access to the primary healthcare services. But because we are not able to implement it effectively, we still have a chunk of them that are paying out of pocket. And because of that, they are not able to access healthcare. So making it free, okay, is going to eliminate the barrier for these people. And we can talk about financing. How much of the national health insurance scheme funding is actually paid for by premium, through premium? Okay, it's about 5% or even less. Okay, yet, I mean, a bulk of the people, a lot of research that I have reviewed shows that a lot of people who are poor still don't have access to the national health insurance scheme. And because of that, I don't think that, I mean, the national health insurance scheme, until we improve upon it, just like NDC wants to ensure that the funding principles are not diverted into other areas, okay? I mean, we are not going to be able to ensure effective coverage under the national health insurance scheme. And that's why the primary health care is a better option. But we'll talk about feasibility, and I'll have some kind of issues with the implementation as well.
Okay. Thank you very much, Dr. Reku. And I would like to say that when we come to the second round, I would give Edu Jemfi and Dr. Kunibi a minute or two to touch on this primary healthcare as far as the feasibility is concerned. So if you are joining us on Facebook, this is CEBSAR TALK. Today we are interrogating the manifestos and we are focusing on the health sector. And like we said in the introduction already, if you missed, we are not here to pitch one manifesto against the other in terms of superiority, but we are here to look for what is good to help change the health system in Ghana. My guests have been Dr. Ishmael Reku, who focuses more on the NDC's manifesto, Mr. Edu Jemfi focuses more on the MPP's manifesto, and Dr. Kunibe, who focuses more on the independent candidates in the person of Marie Kofi Ghana's manifesto. I should also say that they do not represent and speak for these political parties per se. We are having a healthy discussion in order to move Ghana forward. There's not been a lot of comments, I must say. So viewers, please keep your comments coming. We only have a few comments here. One by Houston Emmanuel, who says that writing manifestos by political parties in Ghana is one thing. Implementation, on the other hand, has been and always been a challenge, even when the incumbent has everything at their disposal. It is not funny that all incumbents wait till electioneering year before they start road construction across the country, by which time a lot of people would have died through road accidents, robbery, and a whole lot. So please keep your comments and your questions coming. We are still live here, and there's a CEBSAR talk, and it's the discussion is moving into the second round where we look at the impacts or content analysis, should I put it, of these various manifestos. But before we start that, maybe this time around, I'll start with you, Ishmael. But before I come to Ishmael to look at, I wanted Edu Jemfi and Dr. Kunibe, because the primary healthcare generated a lot of arguments, you know, and it's something which is, of course, very, very important and relevant, as Dr. Reku has explained. I wanted to hear your opinion on that, Edu Jemfi and Dr. Kunibe. I'll start with you, Edu Jemfi. What's your take on this primary healthcare?
Okay, thank you very much. I think that on primary healthcare, the NPP and the NDC seeks to achieve that. The difference is on the model, how they want to achieve it. The NPP would want to achieve the primary healthcare by the NHIS scheme. And data shows that 95% are covered. And data also shows that children, the elderly, and people with vulnerable diseases ought not to pay premium. And perhaps to correct Dr. Reku, when we say that you have health insurance and you have to access health care, the cost is not charged with you when you have the health insurance. If you have a health insurance and you visit any hospital, once you have the health insurance and it's not expired, they will not charge you for any cost. And per the Yeah, that is how it is at the user end. That is how it is. So the cost is not on the, yes, so that is how it is. So you are not charged. And once you have health insurance, of it 95% are being covered now as per their data, the health insurance data. Sorry for the noise. I mean, yeah, per the health insurance data, it simply means that for 95% of our population having the health insurance card, once they visit the hospitals or the health facilities, they should be taken care of. So in a way, the primary health care is being captured. Again, the main challenge with the health insurance model has been with how it has been financed. I think that Dr. Reku spoke to it, how it has been financed and how funds are not readily available. That is the main challenge. In the NPP manifesto, they speak to it that they are going to overhaul the funding structure. As to how they are going to do it, it is silent on it. So I don't have, information as to how they are going to review the funding structure of the health insurance. But I say that this is a government, or this is a political party which has been able to clear the over 10 billion arrears they came to meet with. It simply means that they've been able to revamp the national health insurance scheme, even by the normal, the challenging financial structure we have now, i.e. the scheme. They've been able to manage it to such a case that they now owe 3 months, which is normal because now if you offer the service, you have to prepare your claims and your claims will have to be vetted, to be posted. Now they've introduced electronic services such that you can also submit claims via the internet and whatever. These things have been introduced. So there's one way to mitigate it. So generally, the NDC chooses to use what I refer to as the Brazilian model. The Brazilian model in the sense that government would have to find some money elsewhere and say that I have given this money to cover for all of primary healthcare services. So whether the person has a health insurance or not, once the person comes to the hospital with primary health conditions like malaria, like normal fevers and what have you, the person should be seen. It's like an emergency service. So by and large, they are classifying primary healthcare as an emergency service. Whilst the NPP believes that for them, they have to use the health insurance. And I say, if they indeed want to use the health insurance, then they must embark on an aggressive membership enlistment. This is something which they must embark on. That is, if they want to use that, they must embark on, just like they are doing for the National Identification Authority, or the voters registration. That is what must be done. They must aggressively embark on it and make sure, make sure that indeed children do not pay the premiums, which I know they don't pay. The elderly do not pay their premium, which I know they don't pay. And those who are classified as vulnerable do not also pay the premium, which I believe they don't also pay. If they are able to do this, then I believe that they would have answered the question of making making available health services as per the constitution. And again, somebody just reminded me that I have been speaking that NPP did not speak about services, and I make mention of maternal health. They say that if I would want to consider the Rebecca Foundation and what they did at Confanoche, that is what specific to maternal health. And so I should add that to the point. People are military. And again, they say that the government has also made a commitment to construct the, you know that at Confanoche there is a maternity children's block and maternity block unit, which was started by the Champions era in the 80s, which have been left unattended. Various governments have attempted it. I hear the NPP has sourced funding and work is now going on. So in terms of maternal health care at Confanoche, and I hear in Accra, Kolebu, work is being done on maternal health care. So that is what I would say on the primary health care. So by and large, the two would want to achieve it, but different approaches.
All right, thank you very much, Dujemfi. So I come to you, Dr. Kunibe. Of course, if you hear what Dujemfi and Dr. Reku have said, or what Dujemfi actually said, that it's the same thing that both parties want to achieve, except one, it's using the Brazilian approach, as he said, and then the other, it's perhaps through the National Health Insurance Scheme. But what's your take on the NDC's promise on
the Germans approach?
Sorry?
The Germans approach.
The Germans approach. I hear you. But what's your take on the primary health care as promised by the NDC?
Okay, maybe a bit of history will help. I don't know, all of a sudden, it seems the Ghanaian people probably enjoy listening to free things, free promises. And so politicians want to promise free things. We have traveled this road before. You know, if you look at the history of our health financing, healthcare was free at independence. It was free at independence until at some point, I mean, and if you remember the famous, one of the famous reasons Rawlings gave for one of his coup d'etats was that the Kolegu Teaching Hospital is now a mortuary. Because at some point we could not simply raise enough to finance health at the point of delivery. We just ask that people go when you are sick and then you get services done. The difference is that we are talking about primary care and not all health care. Question I ask is, are we gonna, well, but the NDC also says NHIS will continue. So my assumption is that they're going to get money from the NHIS to be able to finance the primary health care. Now, it becomes an add-on. It doesn't take away the fact that you still have to register and become a registered member of the NHIS. Except if my understanding is correct, that even if you do not register for the NHIS and you are sick, you will still have free primary care. If this understanding is correct, then we are likely to further deteriorate the NHIS because people are not likely to enroll on it because they know most of the care at the rural facility, I mean rural level is primary care anyway. So I have no problem with offering free things, but we should always look at how feasible they are. We currently have free senior high school in Ghana. It's all over the place. And I think it's one of the green cards, so to call, of the MPP. But if you ask me as a lecturer, I am really, really very worried about the quality of students that I'll soon be receiving and having to deal with, you know. Plus, these free things have always tended to make the vulnerable more vulnerable. You know, they have always tended to make the vulnerable more vulnerable in the sense that, look, make it, you say free primary health care, then we are not able to supply enough drugs, enough equipment at the primary facilities. The only option is that people must still have to move to the secondary facility, right? Yeah. And so I would always prefer that, look, let's fix our things. We have enough systems in place. Let us begin to fix those things. Let us get those systems to work rather than promising more and more things. And if you like me to veer off into education and come back, our educational system has been battered and battered and battered. And if you ask me, I don't see where we are going. As a country, we need to say that, look, in the next 50, 60, 70 years, irrespective of who is in power, this is what we want for our kids in terms of educating them. In the next 50, 60, 100 years, this is what we want for our mothers in terms of their health, for our kids in terms of their health, for our aged population in terms of their health, for adolescent health. This is what we want. Unfortunately, and I'm really afraid that a time will come, if we are already not there, that we have NDC Ghana and NPP Ghana, which makes it difficult for us to have, you know, a certain vision and for people to join into building this nation.
Okay.
You know. So this idea of free things, in any case, they are really not free.
Yeah.
They're not free.
Absolutely.
It's taxpayers' money. So I don't know which political party asks its members to contribute money for them to implement anything for Ghanaian population, and then they call it free.
Absolutely. Let me say thank you.
I'm not a fan of these things. Let's get our systems work.
All right. All right. Thank you very much, Dr. Kunibe. So I start with you in this round. We've already started the second round, I must say, and also time is fast spent. Dr. Rekun, let's look at the feasibility. I know we've started with the primary healthcare, and I intentionally brought it because I thought it generated a bit of controversies, and we've seen the different views out there, both parties trying to achieve the same universal care, but through different ways. And of course, Dr. Kunibe's view on being careful with some of these free things. But let's look at the NDC's manifesto and what examples of these promises, if you can point out any, do you feel that this is feasible, in terms of the finances and the political will, that this is probably possible? And then you could add a bit of the impact. Because of time, we might not be able to do the supposed impact of these things. But if you could add, the feasibility and the impact together, this would be good. So what are some of the promises that you feel, yes, this easily can be achieved? What are the others that you feel cannot be achieved, and why?
All right, Evans, thank you. So, like I said, there are programs we have in Ghana. And the fact that NDC want to, engage in infrastructure project, I think a lot of the infrastructure project can be achieved, because NDC has, record of building some infrastructures across the country. We have seen MPP also doing similar. So when it comes to say that I'll build or expand infrastructure, I see that there's the potential that they will build some of these infrastructure, especially like the district hospitals, in the 6 new, the regional hospitals in the 6 new regions, they can do this. I think that is feasible. And also, trying to, I'll reserve that one because I have an issue. I would like to address it separately. But I can also see that trying to recruit some health workers, they may not be able to recruit all of them, but they will still be able to recruit health workers, some of them, because that has been the usual agenda. But they may not be able to recruit as many of them as probably some of us may be thinking because of the financial rigidities in the system. So they may not be able to do everything. But when it comes to infrastructure development, recruiting health workers, and even their COVID-19, trying to promote the development of PPEs locally, I've seen that some of them have already started. So doing it is going to be easy for them to do. But I would like to focus on what probably may be challenging for them. When it comes to the promises they made. Let's talk about free primary health care, for instance. I think, to me, it's a brilliant idea. It's a brilliant idea. Looking at the challenges we have in the country and the challenge with the National Health Insurance Scheme, that I mentioned, and I still think they are very critical challenges. And for that matter, having a free primary health care is going to resolve that problem. There's a problem of feasibility, and I hope that NDC is not making the same mistake they made in 2008 when they said they were going to introduce the one-term premium. Which they couldn't do it because when they came, what does one-term premium mean? It was difficult for them, Are you going to say that if you pay your premium for 1 year, that is it, you're not going to pay any other premium? Or are you going to calculate the premium based on average life expectancy of Ghanaians and then multiply it by the yearly premium and they pay all at once? It was very difficult for them. So it was a mistake and they couldn't implement it. The free primary health care, they intend to implement free primary health care in tandem with National Health Insurance Scheme. I think that the two of them cannot be implemented at the same time. It's either you go, there are alternative policy approaches. It's either you go free primary health care or you go National Health Insurance. That's my take on this. And I believe that the free primary health care will be able to address some of the challenges of the National Health Insurance Scheme, but they cannot be implemented I mean, at the same time, side by side will not be effective. So I hope that you are not thinking that you are going to generate money through the National Health Insurance Scheme to finance the free primary health care, because there will be nobody to,
exactly.
to enroll in the National Health Insurance Scheme. So for me, when I read their manifesto, I see that that kind of thing is not going to happen. I think that if they really want to implement free primary health care, they have to focus on how to generate that through some state financing of healthcare. You know, some countries, even Canada and so, they do state financing of healthcare. Okay, and so if you want to go that approach, that is one option. If you want to go to the National Health Insurance Scheme, which Mr. Julius called the German approach, okay, that is also another approach. You can choose them, but don't think that you get revenue from the other one to finance it. If you do that, you are mistaken, because there will be nobody to assess. I mean, every rational human being will think that it's not even worthwhile to enroll in the National Health Insurance Scheme if I can get free primary health services. There's no rational, I mean, there's no rationality in that joining the National Health Insurance Scheme. So for that, I'm thinking that it could be problematic, and I think that they should think through properly and get the necessary financing available to be able to enroll this free primary health care. Okay, but I mean, people are saying that the National Health Insurance Scheme provide, yeah, until we strengthen the National Health Insurance Scheme, I mean, we will not be able to achieve the goal of the policy, because people should not forget that, you know, people should not think about the free things being necessarily a bad thing. It's not a bad thing. You know, the objective of government is to have a universal health coverage. The policy approach towards achieving that is another thing, okay, and not necessarily the free. I mean, there's nothing like free. It's tax funded.
Yeah.
You know, Canada healthcare is tax funded. So it's something that can be done. The health insurance, especially if it's not generating enough, when people are not, and the issue is that the National Health Insurance Scheme should have a lot of people. You know, insurance is cross-subsidization. You need a lot of people to be in the health insurance program. You even need a lot of healthier people joining the National Health Insurance Scheme versus people who are vulnerable. Otherwise, there'll be a huge cost on the health insurance scheme. So there are challenges, and once it is not effective, people are not going to enroll, and there will be health insurance in theory, but not in practice. Okay, so that is one thing I think we should look out for. They're reducing maternal mortality by 50% in the next 4 years. It's not achievable. Okay, we cannot achieve, I think average, we are doing like 2% or so reduction. Okay, so saying that in the next 4 years, I'm going to cut maternal mortality by 50% is something that cannot be done. And we should not even think about it. I mean, it's not going to be possible. But I mean, it's a laudable idea. Like I told you, focusing on maternal mortality is a great thing. But I think that the objective is too ambitious, and it will not be achieved in the next 4 years. And that is the same reason. I think the parties usually have 8 years agenda. The same thing. That's why we are seeing a few promises in the NPP manifesto. It's not because they are in government, but it's because the promise they made in 2016 is a long term. You can't even achieve them in 4 years. The same thing, NDC's manifesto, I see it to be a long-term manifesto, so that in 2024 election, they may come with only 2 promises because they've not been able to achieve the previous ones. Okay, so these are the 2 main things that I want to highlight regarding the feasibility of the promises that NDC is making. I think that their promise on maternal mortality, reducing it by half is not going to be possible. It's a relevant program to try to promote maternal health, but I think that the promise is too ambitious, and we can actually do less than the promise in 4 years. Right.
All right.
So yeah, so that is it for me for now. Unless you have over.
Thank you very much, Dr. Rekun. I had a follow-up, but please quickly because of time. So I think it's pretty much the same thing that the Dujenfi said. The free primary health care vis-a-vis the National Health Insurance Scheme seem to be the same thing, that, you know, they're going to achieve the same universal care. And you seem to support more the primary free health care because of the challenges we have in the National Health Insurance Scheme. So would you then propose that maybe we elevate the National Health Insurance Scheme into secondary health care? I mean, in the case if you had to advise the MPP manifesto, would you say that we should maintain the national health insurance scheme, but this should be for secondary healthcare whilst they implement their primary healthcare? Briefly.
Yeah, I think that would be an option for NDC, okay, if they intend going by free primary healthcare. But the issue is that I don't want them to put, any faith in the national health insurance scheme if they decide on free primary healthcare. The reason why I'm saying so is that, a chunk of the health services we provide in the country are over 75%, so even about 80, 90 are being provided at the primary healthcare level. Okay. What it means is that if you decide to maintain the national health insurance scheme, it's only a few people, probably the rich, who want to think, we load this country. Some of us have high discount rate, and we will not be able to think too much into the future that in case I get emergency situation, like, our Mr. Edujefi is about oncology or whatever terms they have for highly expensive care. It's only the rich who are going to provide for that in the future. So only the few people who enroll in that national health insurance scheme. And with that kind of insurance scheme, it is not going to be successful because there will not be a strong financial base for that national health insurance scheme. That's why I don't want them to put their faith in the national health insurance scheme if they want to go by primary healthcare.
Thank you very much. I think it would be great to have you one of these days to discuss about the national health insurance scheme and your take on that. Thank you very much, Dr. Rekon. So I come to you, Mr. Dujemfi. What do you also think in terms of feasibility and the impact of these promises that have been given? Time is fast spent, so please do it briefly for us.
Thank you. I largely, like Dr. Rekon said, MPP, they were very much cautious with the promises they made this time. And so most of the promises, as far as I'm concerned, are highly achievable. Trying to achieve universal health coverage is something they can do. Like I said, the proposal would be that they would have to scale up the registration of the national health insurance. That is something they can do. They want to set up infectious disease centers. This is something they can do. And they want to do that in the 3 ecological zones. Highly, this is something they can do. And the setting up of the infectious disease center by the private sector and government shows that this is something which could also be done. Then digitization of health. There is already a project going on, the e-health, the HIMSS, and that of the telemedicine. These things are going on already. So this is something that is very much achievable. And in terms of promotion of healthcare, health promotion and prevention, these things are also within reach and they can easily achieve. Then also health infrastructure, the Agenda 111 and the construction of 6 regional hospitals in the new regions and trying to also build a new region in a new hospital in Western region and what have you. These are issues about infrastructure. What I say is that these are all about the political will. Once you have the political will, you should be able to handle all the issues of infrastructure. Training and capacity development for health workers. This is where, sometimes I have the challenge with the MPP. Most of the time, in terms of training and capacity development, their focus is so much more on medical officers, which is good, but I think that they should also include all the other health professionals. Now we have in Ghana specialist training colleges around. We have the nursing and midwifery training their specialists. We have the medical lab and the allied health group training their specialists. We have the pharmacy council also training their specialists. There should be that support. So this is something they should also be looking at. And the recruitment of staff. Yes, they have demonstrated that they can because they've met a backlog and they've been able to recruit about 90% of them. So they've demonstrated that they can. I think the main challenge that the MPP would face is in the area of the health regulation and legislation. This is the main challenge. Now, if you are in the health sector in Ghana, you will realize that there has been some exchange of letters even between the Ghana Medical Association and the Medical Laboratory Scientists Group. Why? It is because of the practice of laboratory physicians and what have you. These are matters and also the other groups, the biological science group. These are matters that you have to handle with a lot of tact. And sometimes as a political group, you don't know where to tilt, whether to go this way or come this. Then they say attempted saying that when they come into office, they would, set up the medical lab council, which is okay, which is good. But you have to also look at the other groups how they will feel about it. So by and large, I think that the NPP's manifesto really captures a whole lot of things which they should be able to implement within the next 4 years. I think if I have 2 minutes, I'll look at 2 main things or 3 things which I feel the manifesto did not look at, if that is my final time.
If you can do that in a minute, this would be great.
Okay. So I say that our healthcare system is not looking at issues on the pharmaceutical industry and the biotechnology industry. They are not looking at our diagnostic infrastructure. And they are also not looking at what I refer to as the general health economy. If COVID has taught us anything, I believe it has taught us that we shouldn't really focus on importing medicines from abroad. Now, we have somebody with COVID and basic laboratory tests cannot be conducted. Look at what happened with the PCR testing. A research institute like Noguchi was the one handling it. And these are very common, those of us here in Europe and in America, we know that these are very common in our hospitals. And these are simple things which could be done. So I believe that this is something none of the manifestos spoke about that. The pharmaceutical and the biotechnology industry, it is a huge industry which will even feed the health service itself. So I think they should look at it. And also they should look at the diagnostic infrastructure. And I also think that we should have a conversation on this nursing training allowance. We should have a conversation, a future conversation on that one as well. So generally, by and large, I think that the NPP manifesto captures a whole lot of things. And it will be good. Yeah, thank you.
Thank you very much, Mr. Dujemfi. So I come to you, Dr. Kunebe. If you look at Marie Kofi Ghana's manifesto, do you find them achievable and useful?
Thank you. Yes, generally, I think most of the issues are feasible, but they require a lot of political will. For example, he talked about geographical access, financial access. These are pretty straightforward. If we allow the NHIS to work, there should be financial access. And for me, I just think that anybody who forms a government should be disciplined. Let what belongs to what budget goes there. It's as simple as that. And so if the National Health Insurance Scheme is made to work, it is possible that we can improve upon our financial access to health. He talked about functional access, which is to say that the systems should function in a way that people are happy going there. This is feasible, but really requires a lot of political will. As I said in the beginning, I haven't seen much on responsiveness. And if our systems are not responsive, I don't see how they will become functionally accessible to the population. He also talked about health infrastructure and creating, building 6 new regional hospitals. I mean, these are buildings. It's a question of, if you ask me, yes, it's feasible, but comes with another cost of budget deficit to the government, because clearly we are going to run again to the World Bank or the IMF to ask for money to do these things. But yes, they are feasible to do. What I see will be a challenge because of the fact that we cannot force human beings to do what they don't want to do, is the equitable distribution of health human resource. This, for me, will be the ideal, but I see that as previous government have struggled with, it will be a difficult task, because I am aware, for example, in Upper West, doctors are usually posted at the beginning of their service, and many times they don't report, and nothing is done. I mean, there is no law anywhere which says that once you're posted to this place, you don't go, you are sent to jail. And nobody can enact such a law, you know. So until we really have a holistic approach to this, maybe training more doctors. And again, I don't see why we cannot train more doctors. I just think it's a certain, to be blunt, protectionist attitude that we have had in this country. I don't think that we cannot train more doctors. But being an economist, of course, I believe the fear is that if we have more, then our value reduces. But see, we are supposed to build a system. And so we have to get to a point that, we have to face the bull by the horn and do the things that are right. But otherwise, yes, I think it's generally a good manifesto, especially coming from an individual without a lot of institutional structures. It's a bold step, and the intuition, the reasoning, and the energy that is put into a lot of these things. And let me say that it's the only manifesto that I found having key performance measures at the end of the day. I mean, clearly saying that at the end of our term, you can measure us by looking at whether we have been able to improve life expectancy by 20%, whether we have been able to increase coverage of the NHIS membership by at least 55% in 4 years, whether we'll be able to expand what they call the Health Access Quality Index to at least 50% in 4 years, and then improve health sector efficiency ranking by 50%. So I think generally the manifesto is good, feasible, even though there are a lot of issues that will have to be addressed should he get the nod. And of course, I'll leave it here. Yeah.
All right. Thank you very much, Dr. Kunebe. So this has been CEBSAR Talk, and I would give all of you a minute or two, to give your concluding remark regarding the way forward in, strengthening our health system. So I'd like to begin with you, Dr. Kunebe.
Okay. I think that the way forward with our health system is that we should have a national agenda. Let's have a national agenda and let everyone work with this agenda. I really get scared at the moment because we are not having governments, but we are having parties. Why do I say that? We have a situation where now it's no longer that this is what belongs to Ghana, but it is that at this point in time, Ghana belongs to NPP. At this point in time, it belongs to NDC. And so NDC or NPP can choose to do what they would like with our health system. This is not healthy. It's not healthy because we have traveled this road before, and we have seen that at any point that we decide as a nation that we want to do this, we have always done it well. And the very many times that we have always decided that we want to do things the party ways, they never work. I don't know why we will not think national rather than thinking this party. I would have loved that this discussion is about this is the national vision and how do parties prepare to implement the vision, rather than having a discussion on party manifestos, because really, like one of the panelists said, one of your contributors who sent a message, yes. These manifestos, as I see it, they are meant to woo voters. And the moment voting is over, hooray, we then do what we can do, And I think that the way forward really should be that let's start building a national debate, a national consensus on the way forward, and let parties implement the agenda, rather than this is my way and that is your way. And so it is up to the point that when Party A comes to power, they just ignore what Party B has done in the sector. And I mean, we have health infrastructure, hospitals that are built, we are not using them because NDC built those hospitals. It's such a shame. NDC didn't build those hospitals with their money. They built the hospitals with their taxpayers' money, you know. And I'm not saying this to make anybody feel bad, because the other way around has always been that, I mean, for example, the NHIS started struggling in the first few years when NDC took over power, because it was like, this is not our baby, you know. And then this type of thinking, honestly, is not healthy for Ghana. Thank you. If not healthy for our health sector, and if we want to see a lot of improvement, we should have a certain vision that parties should rather implement, and not that parties should come with their, you know, manifestos and force Ghana to implement. Force Ghana to implement in the sense that parties come with their manifestos. When their party gets into power, you know, it is like, if we don't do this, you know, we cannot go back to the people. Yeah. That should not be. You, once you form government, you are the government of Ghana, not the government of NDC or MPP. And so for me, we should have a national vision.
Thank you very much. Thank you very much, Dr. Kunibe. So the summary is that we should have a national agenda for health. I mean, it's a bit tricky, you know, if political party manifestos have become very essential. We actually had a program also here. And sometimes the question also is that if we have a national agenda, then how do political parties sell the ideas to voters to vote for? But I think it's pretty much clear from you that we should at least have a national agenda for our health policy. I come to you, Mr. Dujemfi, please do it snappy.
Okay, thank you. Basically, on the issue of the national agenda, the Ministry of Health has what is referred to as the National Health Policy. And for any or most of the health areas, service areas, they design policies which are supposed to be implemented by the practitioners or the professionals. So that is what happens with that. So that is what happens with that. But generally, if you want to look at our health structure, COVID has taught us a whole lot of lessons. The fact that our health service or health care is not ready for emergencies, it has taught us, even though we have been able to manage it, but there's a lot of work to be done. The MPP captured it, gave an account of it, fine, but there is a lot of work to be done. Like I spoke to, and I think Dr. Reku also spoke to it, we need to look at our manufacturing sector, the health manufacturing sector, i.e. pharmaceutical, biotechnology, and even the manufacturing of health equipment like the PPEs and whatever. These are things which could be done easily, like the gloves and whatever. These are things which we have to really look at it. And again, we have to look at our diagnostic infrastructure. Again, this is something that we cannot toy with anymore. There ought to be a national policy on that. And we have to have it. We should have it. Then the last one would be, I say because this is very tricky. The last one would be our training and the culture, our health culture and the training. I have seen what is happening here in Germany, and I would say that we really need to retool how we even train our students and how we even train our professionals. We have to really retool it. So basically, yes, we are fine as Ghana. The statistics show that a lot of the life expectancy is going down. Health insurance is registering a lot. Maternal mortality rate is going down, and what have you. These are all good, but there's still a lot of work to be done. Thank you for the opportunity once again.
All right, thank you also very much, Mr. Dujemfi. So I come to you, Dr. Rekon, your concluding remark in a minute.
All right, thank you, Evans. I just want to say that I love the various perspectives on building universal health coverage. And I think all the parties have this objective, kind of trying to ensure that we have universal health coverage for all. It's a great thing. And I also love the various approaches, whether national health insurance or free primary. These are all important for us to reach the goal of universal health coverage. We, however, need a strong political will and strong financial base to be able to manage or achieve some of these goals we have set for ourselves. But going forward, my recommendation for the country and for the various political parties is to look at, like Mr. Dujemfi talked about, how we can use the local actors, okay, trying to use even traditional medicine, how we can use it, I mean, to in tandem with the other medication we get from abroad, so that we can reduce the cost of healthcare in Ghana, okay? Because drugs alone cost a lot of government revenue. So it is important that we integrate traditional medicine and local, I mean, efforts in order to ensure that we actually reduce healthcare in Ghana. And that will actually help us to achieve the universal health coverage we need in our country. Thanks, Evans.
Thank you.
Sorry, just to add it.
All right.
Traditional health medicine has now been integrated in the healthcare. They now have a directorate at the Ministry of Health. So now traditional medicine, if you go to Atunsa Gogo Hospital, for instance, in Kumasi, you have a consulting room for such. So it has already been integrated. We need to scale it up, yes.
All right. So thank you very much. And our guests have been Dr. Rekun, Mr. Edu Jemfi, and Dr. Kunibi. This has been CEBSAR Talk. Today we looked at the topic interrogating the manifesto as a focus on health. And generally, the promises look good. But as has been said by our panelists here, we should also not forget to have a national agenda and be responsive, pay attention to our emergencies, pay attention to diagnostic structure, improve upon training and our health facilities. And there should also be the financial will and political will. And I think if we pay attention to all of these things, we could move Ghana's health system forward. I am Evans Apia Kisi, the host of CEBSAR Talk. See you next week as we take on another sector. Thank you very much. Bye-bye.